Hi everyone, in this video I'll give you a brief overview of raised intracranial pressure. For some key background information, the normal intracranial pressure is between 7 and 15 millimeters of mercury. And the skull, as you may know, is quite famously very hard, and therefore it is difficult to squeeze more things into it. It does not give in, and therefore if you for any reason have more things trying to fit into the skull than there are meant to be, it will cause the pressure inside of it to rise. The main causes of raised intracranial pressure are, first of all, idiopathic, so no particular cause can be found. Neoplasms or space-occupying lesions are often the cause. You can get focal edema, so some fluid swelling within the brain, as well as a cerebrovenous thrombus can cause dilatation of the veins, etc., which will exert more pressure on the rest of the structures and therefore increase the pressure. Now, for the cutoff that is typically used, it is normally around 20 millimeters of mercury that you use. In terms of the clinical presentation, you get the core triad of a headache, papilledema, and vomiting. The headache is typically worse when waking up or on bending over, which are activities that would increase the amount of fluid or blood, particular, rushing into the head, which would exacerbate the symptoms. Other symptoms to be aware of are early waking, again from the headache. It can wake patients up from their sleep. The vomiting, dilatation in one eye due to compression of the cranial nerves. And you can get something called the Cushing's triad, which is irregular breathing, widened pulse pressure, and bradycardia. Cushing's triad occurs quite late into the presentation of raised intracranial pressure, and when it is present, it becomes a medical emergency, as it signifies that there is a risk of coning, where the brainstem gets pushed out of the skull, which can result in death, and therefore you should be looking out for those symptoms in a patient, as this requires immediate treatment. In terms of the investigations, the main one is a CT and an MRI. It helps detect any space-occupying lesions, and it's your go-to investigation, at least at first, for raised intracranial pressure. You can also do something called intracranial pressure monitoring, where you essentially put a catheter into one of the ventricles inside the brain, specifically the lateral ventricles, to determine what the pressure is like, how it's changing, or if it's changing at all, etc. In terms of the management, first of all, you want to elevate the head to roughly 30 degrees. As I said before, lying down or bending over exacerbates the issue because more fluid can rush into the head, so elevate the patient. Next, you can use mannitol, and it is used in order to dehydrate the cells in the brain slightly. Essentially, the water from the cells leaves and enters the bloodstream and can be drawn out, and once the water is in the bloodstream, there is less of it in the skull, which decreases the amount of pressure present. Mannitol essentially also hinders the reabsorption of water and promotes the excretion of sodium chloride by increasing the GFR, and therefore aiding this process of reducing the pressure inside of the skull. You can also do controlled hyperventilation if mannitol does not work. The thought process behind it is that you want to reduce the PCO2, which in of itself would therefore cause vasoconstriction of the cerebral arteries, and because the vessels constrict, again, there's less pressure exerted by them inside the brain, which therefore would reduce the intracranial pressure. You can also do removal of CSF if everything else fails, and that can be done through draining, through the intraventricular monitor that I mentioned earlier. You can do repeated lumbar punctures, which is done in patients with idiopathic intracranial hypertension. And in patients with hydrocephalus, you can perform ventricular peritoneal shunts. This was a very brief overview of raised intracranial pressure. If you have any questions, feel free to leave them down in the comments. Other than that, I hope you enjoyed. Please consider subscribing, and thank you so much for watching.